As many of you know, a couple of years ago, I was treated for head and neck cancer. And the question that someone sent in was, what poses, what yoga poses did I find most useful during my cancer journey? For the answer, stay tuned. Almost exactly 2.5 years ago, I finished chemotherapy and radiation therapy to my head and neck for cancer on my tonsil that had spread to lymph nodes on the opposite side of my neck. Now, I had some warning. I had about a month between when I was diagnosed and when I was going to start treatment, where I could kind of figure out what I was going to do. And in fact, I had enough time that I went to India and had some Ayurvedic treatments to try to balance me. Not aimed at trying to cure my cancer, but aimed at trying to balance me to put me in good shape to withstand the rigors of the conventional medical cancer treatments that I would be getting. And I'm very glad for that opportunity. And when I was there, I did a ton of research. And I researched all kinds of holistic modalities. I thought about what yoga approaches I would use. I thought about what dietary interventions I would use if my mouth were too sore to chew food. For example, I figured I might use juice and smoothies and things. But as I discovered, once this journey really began, when I got back to the States, was that I had to throw most of my plans out the window because there were just unexpected complications and side effects that no one had told me about and things that I just didn't fully appreciate until I got there. And of course, what we learn to do in yoga and yoga therapy, ideally, once you've been practicing long enough, you start to know when things are serving you and when things are not serving you. You have a sense of how much energy you have. You have a sense of whether today you need more restorative poses or you're ready for a more energetic practice. And in fact, fatigue is one of the very first side effects that sets in from radiation therapy. And in fact, early on in my treatment, even just standing up, inhaling and lifting my arms over my head felt like more than I could do. I've had a daily practice of meditation and pranayama, which is yoga breathing techniques, for many, many years, along with asana and other things as well. And, but again, early on in my treatment, I couldn't sit up to meditate. I didn't have enough energy. So in fact, I tried to meditate on those days lying down with some success, but not great, honestly. Okay. And then with asana, it was very much, some days I felt energetic and I could do more, but then other days I couldn't. Now, my go-to restorative pose is a pose known in Sanskrit as Viparita or legs up the wall, or supported legs up the wall, where you basically rest your pelvis on a bolster, your legs angled toward the wall, and your upper body is kind of in a shavasana position with your palms turned up out to the sides, and you close your eyes and just rest in the pose and let gravity and the props do the work. You just lie there and breathe. Now, legs up the wall, Viparita Karani, has been my go-to pose for years. But what happened within the first few weeks of starting my treatment for cancer was that I started getting secretions would build up in the back of my throat. And these would cause me to cough. And coughing at that time, because the entire inside surface of my mouth was inflamed from the treatments, were incredibly painful. And I couldn't stay in that pose more than 10 or 20 seconds before I'd have to come out. So I pretty much just gave that up for a long time. And instead, I ended up coming to a pose called supported Baradwajasana, which is another restorative pose in which you're kind of doing a twist with your legs off to one side and your chest turning the opposite way, torso resting on a bolster, head turning back in the direction pointing to where your knees are pointing. Now, this turned out to be not only wonderful feeling and profoundly restful and helpful, it also helped to maintain range of motion in the neck. Because when the head and rib cage are turning in opposite directions, as they do in that pose, you get a wonderful stretch to the neck. And one of the serious long-term complications of radiation treatment to the neck is something known as fibrosis. A stiffening of the tissues in the neck can affect the esophagus, can affect your ability to swallow, can cause pain, can make eating difficult. Really a very nasty long-term side effect, which I actually only learned about because I was doing reading. Nobody warned me of this possibility. But I learned that conventional medicine doesn't really have any good answers to it. So I started to do a number of things to try to prevent it, both during my treatment and after my treatment, because this is a side effect, fibrosis, that often comes on 3, 4, or more years after you finish treatment. So I wanted to do stuff to try to prevent that. Because, you know, my mission during my treatment was to not just survive, although that was obviously also a priority, but to try to come out as whole as possible. And I really think the various things I did, including fasting during chemotherapy, and yoga, and Ayurveda, and other things, were incredibly helpful to me. I write about a lot of this stuff in my most recent book, which is called Saving My Neck, A Doctor's East-West Journey Through Cancer. So you may want to check that out. So in any case, it was a moving target. Once I got back to Vermont and was able to do a little bit more as my energy started to come back. And by the way, it took about a year until my strength and stamina were pretty good. That's another long-term side effect of the treatment. So I just titrated my level of practice up. I let my body and my breath and my experience dictate to me what to do. Now, if you're not as experienced in yoga, you would be benefited by having someone help you make those determinations. But more and more as you do the practice and you develop the sensitivity, you learn to put your yoga therapist out of business and figure out what you need all by yourself. Okay, that's all for today. Thanks much. Namaste.